I, Chairman Charles McHenry, call to order the Health, Education, and Welfare Committee, February 10th. The time now is 10 a.m. I ask invocation from Representative Ms. Mary Crawford, please. We have roll call by Legislative Clerk, Ms. April Lindsey.
Mary Crawford.
Present.
Laura Harjo King.
Present.
Charles McHenry.
Here.
Thomasine Osborne.
Present.
Darrell Proctor.
Here.
There you got 5 present and 0 absent.
Thank you. We have 5 present and 0 absent. That constitutes a quorum. All business will be official. Next on the agenda will be the approval of minutes. No, we've already gone over the minutes, so may I have a motion, please?
Chairman,
Yes.
I make a motion that we approve the minutes with any necessary changes.
We have a motion made. Can I have a second? Second by Representative Laura King Harjo. Chairman, or roll call vote.
Mary Crawford.
Yes.
Laura Harjo King.
Yes.
Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
There you got 4 in favor and 0 against.
We have 4 in favor, 0 against. Those minutes have been approved. Next on the order of business, we have TR 26006, a tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute an assurance of continuing support of the Muskogee Creek Nation Tribal Family Assistance Plan through the U.S. Department of Health and Human Services Administration for Children and Families. Sponsor, Representative Thomasine Osborne.
Chairman, motion for due pass.
We have a motion for due pass. We have a second. Discussion. Is there discussion?
We have Ms. Lauren Randall coming to the podium, Chairman.
All right. Good morning, Ms. Randall.
Good morning. I'm Lauren Randall, and I'm the TANF director, and we renew our plan every 3 years. And so moving forward, we are having to have a tribal resolution for every plan for TANF to continue.
Are there any questions? Committee. Any questions, representatives in the audience? Questions, any representatives online? Roll call vote, please.
Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
Mary Crawford.
Yes.
Laura Harjo King. There you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. At this time, I would like, thank you, Madam. At this time, I would like to relinquish the chair to Ms. Representative Mary Crawford, please.
Next piece of legislation is TR 26007, a tribal resolution of the Muskogee Creek Nation approving the absentee workers for the 2026 Muskogee Creek Nation special election. Sponsor is Representative Charles McHenry.
Chair, make a motion to do pass.
We have a motion for a due pass. Do I have a second? Second by Representative Osborne. Discussion?
Yes, I believe we have Mr. Nelson Harjo here.
Good morning, Council. We also have Chair Sarah Barnett online, so I'll defer to her unless you have any specific questions that you want to ask for me. Sarah, are you here with us?
Yes, sir. And Mado for the time here today. And I just want to say I appreciate the sponsors of these bills and getting all three on the same meeting. It makes it very efficient on our behalf. So I appreciate that. But my name is Sarah Barnett, and I serve as the current chair of the election board. And you have Andrea James, another board member there with Mr. Harjo. The list that you have there in front of you for the absentee workers are the same workers that we utilize for the 2025 election. They meet all of the necessary qualifications and have passed the background check that's been conducted. And so happy to answer any questions that you might have.
Any questions from the committee? Representatives present? Or representatives online? Roll call vote, please.
Charles McHenry,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne,
Yes.
Darrell Proctor.
Yes.
Madam Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. That passes.
Mado.
The next one is TR 26008, a tribal resolution of the Muskogee Creek Nation approving the early in-person voting sites for the 2026 Muskogee Creek Nation special election. Sponsor is Representative Charles McHenry.
Chair, make a motion to do pass.
We have a motion for a due pass. Do I have a second? Second by Representative Osborne. Discussion?
Chair, we have Miss Sarah Barnett again.
Mado. These are proposing the same early voting sites as we have utilized in the past. I know that there's always questions about voter turnout and at these sites and whether it's worth the investment. Given the fact that this is a special election, which occurs at a different time of year than our citizens are used to, as well as that it could have implications for amending the Constitution, the board agreed that we didn't want to make any changes at this time, so we're proposing to utilize the same for early voting locations. Thank you.
Any questions from the committee? Any questions from representatives present? Any questions from representative online? Roll call vote, please.
Charles McHenry,
Yes.
Mary Crawford.
Yes.
Laura Harjo King.
Yes.
Sorry. Thomasine Osborne.
Yes.
And then Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
4 in favor and 0 against. That passes. I now relinquish the chair back to our chairman, Representative McHenry.
Representative Crawford. Next, we have TR 26009, a tribal resolution of the Muskogee Creek Nation confirming the nomination of Andrea James to serve on the Muskogee Creek Nation Election Board. Sponsor is Representative Laura Harjo King.
Yes, I make a motion for the pass.
We have a motion to do pass. May I have a second, please?
Second.
We have a second by Representative Crawford. Is there discussion? Thank you. You may have the floor.
Mado for having me here and for sponsoring this nomination. This will be my second term. I got on basically 4.5 years ago, right before the 2021 elections. So I've learned a lot. When I believe when I came before the committee at that time, I was asked basically what I knew about Title 19. Now I didn't know anything. Now I can tell you I've been through it too many times to count. Worked with it. We've revised it. We're still looking at it, bringing it up again. So it's been enjoyable, and it's also been tough. But our goal is to continue to make sure that we have fair elections and promote voter participation.
Thank you. Thank you very much. Are there any questions from the committee? Any questions from those in the audience or those representatives online? If there are no questions, may I get a roll call vote, please?
Laura Harjo King,
Yes.
Thomasine Osborne,
Yes.
Darrell Proctor,
Yes.
Mary Crawford.
Yes.
Terry, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. I asked Ms. Andrea James on the 28th of February on our pre-agenda at 9 a.m. that you'll be able to come before the full council for any questions that they may have. Thank you, Mado. Next, we have NCA 26-023, a law of the Muskogee Creek Nation authorizing the expenditure of funds awarded from the Department of Health and Human Services for the Muskogee Creek Nation Department of Health Special Diabetes Program for Indians Diabetes Prevention and Treatment Projects. Sponsor, Representative Mary Crawford.
Chairman, motion for due pass.
We have a motion for due pass. May I have a second, please? Second by Representative Darrell Proctor, excuse me. Discussion, please. We have Mr. Shawn Terry here. Thank you.
Thank you, Chairman. Good morning, committee. The Grants Office asked us to include this language in all of our grants so that going forward on these multi-year grants that we don't have to come back and ask for additional funding for carryover funds and so forth. I think this is just becoming standard language that the Grants Office is asking for. So this explanation is going to be exactly what I would give on every single legislation following this comment. So I asked them if there was an easier way to include this, that you didn't have to go through each one of these grants individually, but they asked that we do it individually, and that will be the explanation on all of this legislation. I'm happy to answer any questions.
Any questions from the committee?
Chairman.
Representative Osborne?
Mr. Terry, I know Ms. Strobel had contacted me earlier about just what you said. There's some things on each piece of legislation, just about. So when it's multi-year awards and it doesn't look like that the amount on the legislation matches the award letter when it is multi-year. So how does that pan out for us on this end?
I don't know, Spencer, if you want to address that. I've had that same one because, technically by law, you only give me spending authority for a year. And so I've never really been able to, because technically I can't spend past 1 year because you only do a budget for a year.
Yes, Representative, and I think that's an important question. And the discrepancy is explained by carryover and supplemental awards, both of which are difficult to project up front. We may not get supplemental awards from any of these grants ever, and when we do get them, we don't generally know how much they're going to be up front. So we'll work with Ms. Strobel and National Counsel's office to get those discrepancies cleared up and try to come up with a more I think more concrete answer for you moving forward on those.
Okay. I think the only thing, not the only thing, but I think if in the body of the legislation, if it were to address multi-year, it might that's one thing I think that will make a little more sense. So I appreciate it. Thank you.
Thank you, Representative Osborne. Are there any other questions from the committee? Questions from representatives in the audience or online? There are no questions. Roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King, Thomasine Osborne,
Yes.
Darrell Proctor.
Yes.
Terry, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. Next, we have NCA 26-024, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Indian Health Services Native Public Health Resilience Planning Fund Grant for the Muskogee Creek Nation Department of Health. Sponsor, Representative Mary Crawford.
Motion for due pass.
We have a motion for due pass. May I have a second, please? We have a second by Representative Laura King Harjo. Discussion, please.
Same explanation as before, Chairman.
All right, thank you. Are there any other questions? No questions? Questions from representatives in the audience or online? If not, roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne, Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we have NCA 26-026, a law of the Muskogee Creek Nation authorizing the revisions due to Start over again. Next, we go to NCA-26-025. A law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Indian Health Services HIV, HCV, Syphilis Epidemic Project Grant. Sponsor, Laura Harjo King.
Motion for due pass.
We have a motion for due pass. May I have a second? Second by Representative Crawford. Is there discussion? Please, Mr. Terry.
Thank you, Chairman. Same explanation as before. Thank you.
Any questions from the committee?
Chairman, Mr. Terry, I think this is one that will need to be revisited.
Okay.
Thank you. Thank you, Chair.
Thank you. Any questions from those representatives in the audience or those online? If there are no questions, roll call vote, please.
Laura Harjo King, Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
Mary Crawford.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. Next, we go to NCA 26-026. A law of the Muskogee Creek Nation authorizing the revisions due to cumulative funding awarded from the pass-through entity Southern Plains Tribal Health Board, funded by the Center of State, Tribal, Local, and Territorial Support at the Centers of Disease Control and Prevention. Sponsor, Representative Mary Crawford.
Motion for due pass.
We have a motion for due pass. May I have a second, please?
Second.
We have a second by Representative Laura King Harjo. Discussion, please, Mr. Terry.
Thank you, Chairman. Same explanation as before.
Yes, sir. If there are any questions from the committee, any questions from representatives in the audience or online? If there are no questions, roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion has been approved. Next, we go to NCA 26-027. A law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Department of Health and Human Services Centers for Disease Control and Prevention, Strengthening Public Health Systems in Indian Country grant. Sponsor, Representative Mary Crawford.
Motion for due pass.
We have a motion for due pass. May I have a second? Second by Representative Laura King Harjo. Discussion. Mr. Terry, please.
Thank you, Chairman. Same explanation as before.
Same explanation once again. Any questions from the committee? Questions from those in the audience or online? We have no questions. Roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne, Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we have NCA 26-028, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration for medication-assisted treatment, prescription, drug, and opioid addiction. Sponsor, Representative Mary Crawford.
Motion for due pass.
We have a motion for due pass. May I have a second?
Second.
Second by Representative Lord King Harjo. Discussion. Mr. Terry, please.
Thank you, Chairman. Same explanation as before.
Same explanation once again. Any questions from the committee? Representative Osborne?
Thank you, Chairman. This will be another one that may require a supplemental, Mr. Terry.
Yes, ma'am.
Thank you. Any questions for those online or in person? Roll call vote, please.
Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Darrell Proctor.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Next, we have NCA 26-029, a law of the Muskogee Creek Nation authorizing the expenditure of grant funds awarded from the Southern Plains Tribal Health Board and the Oklahoma Area Tribal Epidemiology Center for the benefit of the Muskogee Nation Department of Health. Sponsor, Representative Darrell Proctor.
Chairman, motion for due pass.
We have a motion for due pass. May I have a second? Second by Representative Osborne. Discussion. Mr. Terry, please.
Thank you, Chairman. And thank you again, committee, for your patience. And it'll be the same explanation.
Thank you, sir. Are there any questions from the committee? Any questions from in the audience, representatives or representatives online? We have no questions. Roll call vote, please.
Darrell Proctor, Mary Harjo, Mary Crawford,
Yes.
Laura Harjo King,
Yes.
Thomasine Osborne.
Yes.
Chair, you got 4 in favor and 0 against.
We have 4 in favor, 0 against. That motion passes. Now we go on next to the other business. We have an update from the health systems. Mr. Secretary of Health, Shawn Terry, he has submitted his written report and sent it to us. And at this time, I'm going to ask if the committee has any questions over this written report that Shawn Terry is here to answer at this time. So I know we have others following him. So at this time, we're just going to ask if there's any questions for him. He'd be happy to answer. Thank you, Mr. Terry. No questions from the committee. So no questions from those online, those in person. So therefore, thank you, Mr. Terry, for your report.
Thank you, Chairman.
Thank you, sir.
Thank you, committee.
We have Health System Finance Chief Financial Officer, Ms. Brenda Crawford.
Good morning.
Morning.
My report was also submitted. If there's any questions, I'll be happy to answer.
Yes, ma'am. Any questions from the committee? Questions from those that may be online or in attendance? There are no questions. Thank you, Ms. Crawford, for
Thank
your
you.
report very much. Have a good day. Next, we come to Community and Human Resources. I have, excuse me here, Ms. Carmin Tecumseh.
Good morning.
Good morning.
Thank you all so much for having us. Again, just I think I know most of you that are sitting on the committee and those that are in the audience and online. So we really appreciate the opportunity to come and present information on our programs here. I myself, Carmin Tecumseh Williams, along with Deputy Secretary Aaron Saltzman and our Executive Assistant, Christy Jackson. So today you'll have the opportunity to put some faces with the names as we go through our programs. We are going to offer just some real quick details and quick information over each of our programs. This will also give you an opportunity to have information as we go into next week into the full council's orientation. Before you, I did provide a list of those that will be in what order they will be going into. As they come up to present, they will pass out the information to you regarding their program. So again, thank you so much for having us here today, and we're just excited about being able to provide what information we have.
Right. Thank you, Ms. Carmin Tecumseh Williams. Next, we're going to start off with the Center of Victim Services, Ms. Shawn Partridge. Morning. So,
good morning,
morning.
everyone. My name is Shawn Partridge, and I'm the director of our Center for Victim Services. I've been with the nation, it'll be 23 years in August, so long time. Carmin actually hired me 23 years ago, and I started out in Children and Family Services. So moved over to our Family Violence Prevention Program a few years later, and at that time, we had roughly 5 staff. And in your packets, you'll see I put together just a little one-pager with some highlights about our program. And so since that time, we have grown and we're at a staff of 33 now. And so I am very, very proud of the growth that we've had with our program. It's a credit to our team's really aggressive grant writing, pursuing a lot of different funds to support our program. And so really excited about that. Unfortunately, the need is really there. We're serving 600 plus victims and survivors a year. Primarily, about 70% of those are victims and survivors of domestic violence. Also, sexual violence. We're working with survivors of homicide victims, really all different types of violent crime that's impacting our people across the reservation. With our program, because we are federally funded, while our citizens and citizens of other tribes are our priority, the reality is that throughout many parts of the reservation, we are the only victim service provider. And so we are providing services to a number of non-Native community members as well. And so again, I think that also highlights the work that the nation is doing that's not only benefiting our people, but all people across the reservation. So we really are fulfilling a really important need to many people across the reservation and our communities. We do have 5 offices. And so again, that are really important because as our staff grows, that office space is very important. Some of our services, we provide everything from answering the crisis line, our main program line. We have one number that rolls over to the on-call advocate after hours, and so someone is always answering that phone. Our staff rotate 1 week at a time on call. We are responding in the middle of the night to our hospitals for sexual assault exams with specially trained nurses. Really proud of the partnership that we have with health. We support 2 full-time by contract forensic nurses that are conducting sexual assault exams, domestic violence exams. We're seeing everyone from children to elders, unfortunately, when it comes to those services. So our nurses and our advocates doing that joint response is really, really important. So really proud of that work. We also have an MOU and with our behavioral health, where we have 2 therapists that are behavioral health staff. We pay for them and they service specifically our clients. And so we're working very closely with those 2 therapists as well. And so really, really important, especially for that healing and also navigating the aftermath of trauma that so many of our people are experiencing. Some of the really exciting things that are coming up. Finally, it's been several years, I know a long time coming for all of us, but our emergency housing shelter property is under renovation right now. With Candor, they're doing a tremendous job. We worked with D5, a design company that totally redesigned the interior. And so really, really excited. It is going to be a beautiful property. It's taken a tremendous amount of work, things that we did not anticipate. So the completion date for that is this summer. They are ahead of schedule, and so we're really cranking up our preparations for that. So we'll be very excited to invite you guys to see that property once it's complete. Also, we are working with behavioral health. We've done a great job in expanding victim services. One of the areas that we're really missing at the nation are services for people that are doing harm. So batters, people that are being convicted of domestic violence. And so we're utilizing some of our grant funds, working with behavioral health to create those services that will be culturally responsive. And so that will also help meet a very big need. Right now, there's about 212 domestic violence offenders that are on probation with just our tribal court. Domestic violence presents a significant number of criminal cases that are coming through tribal court. So being able to have those services for offenders is a tremendous need. So we're definitely excited to get those in place as well. And so as you'll see on this paper, again, just some highlights. We've got some upcoming events that are listed, have brochures and cards in there talking about some of our services. So I know this is just supposed to be kind of brief, but if you have any questions, don't hesitate to reach out. And then I'll absolutely can provide more information, I think, next week at River Spirit. If there's any questions, I'm happy to answer.
Thank you. Are there any questions from the committee? There are no questions? Any questions, anyone online or in attendance, representatives? No questions. Thank you, Ms. Partridge. Very well done. Thank you. Next, we have Children and Family Services, Michelle Bender.
Good morning. My name is Michelle Bender, and I am the CFSA Director. I've been in this role for 3 years now. When I came into this role, we were kind of going through some changes at CFSA. And so when I came into the position, we had roughly 16 staff. We had been reduced down to about 16 staff. We quickly rebuilt, and within 6 months, we were back up to about 36 staff within our program. Our program consisted then of 5 different programs underneath. Now we have grown. Currently, as of today, we have 52 staff members. And of the 52 that we have, there are 9 programs that we serve. Under CFSA, we have our administrative program, which consists of myself and an office manager, and we have an office clerk, and then a receptionist. And then we have our intake program, which is under our family protection team. In comparison to DHS, our family protection team would be considered CPS. We have found doing some research in the communities that CPS had a negative connotation associated with it. And so one of the ways to change that narrative was to change the name of some of the programs. And so we changed it from CPS, Child Protection Services, to Family Protection Team. And that way we can come into the community and change the narrative of our program in that of keeping families together. When a complaint of child abuse and or neglect comes into our program, it comes into our intake program. And intake will filter those referrals and then send them to the appropriate program, being either our FPT program or our PSSF program. Whenever a child needs somebody to come out and investigate abuse and or neglect, what we do is have our FPT program go out and conduct those investigations. No child is brought into care unless if all safety measures have been exhausted. We provide services to the family to keep that child in their home as long as the child's safety is maintained. If a child's safety is not able to be maintained within the home, then the child is brought into custody and placed into either a family kinship home or goes into traditional foster care. Our FPT workers will work those cases until they adjudicate in the court, and then it will transfer over to our tribal reunification program. At that time, tribal reunification will create plans for the family to be able to provide services and resources to the family to correct the conditions in which the child was brought into custody. The TRP program maintains the case until the child reunifies or achieves permanency through either adoption to a relative or adoption to a non-relative. But our utmost goal is always reunification of the child. We also have a state reunification program. Our state reunification program works on all DHS custody children, state custody children within the jurisdictional boundaries of the Muskogee Creek Nation. So that unit consists of 5 different staff members, and they work the cases all throughout the jurisdiction. And they make sure to monitor the case to make sure that ICWA is followed and that the best interest of the child is being maintained. We also have an OOJ program, and that OOJ program works outside of our jurisdictional boundaries. So they work the state of Oklahoma, and they are taking care of those cases outside of our jurisdictional boundary doing the same exact thing. We also have an AGPC program, which is it's our adoption, guardianship, and permanent custody. This program has been under development for the last 1.5 years, and we've just about got it tweaked to where it needs to be. And so the manager for this program and the staff they maintain all adoptions through the state and the tribe, as well as guardianships, and then they maintain permanent custody of children who are in tribal custody. Permanent custody children, that means that the child has gone through TRP and has achieved permanency, but without anybody to care for them. So the nation becomes that child's custodian. So we have a set of staff that work with that child until the child achieves adulthood and then makes preparation for the child to enter into adulthood. We also have our CPRT, certification, placement, training, certification, recruitment, placement, and training. We are working on redeveloping the name for this program. It's a little bit cumbersome, and so we're trying to go ahead and make the change over to foster care, because that's classically what it is known as, is foster care. Our foster care is a comprehensive unit. They do all of their recruitment, their training, they do their certifications. and they maintain the home of all of our resource homes. And we call them resource homes instead of foster homes just because they are a resource and an asset to the nation. Our current home count is 51 with, I believe she has 8 applications that she's processing at this time. Our certification team goes across the state of Oklahoma, so they will certify any Muskogee Creek citizen and or any tribal member across the state. And so they attend all of the recruitment fairs and they go out and do recruitment across the state. We also have a Promoting Safe and Stable Families program. And our Promoting Safe and Stable Families works with mostly with our state. They will work with DHS. They also work with our FPT program. And if at any time any of our other programs have a family that's in need, they will also refer. This is a voluntary-based program. And so the families that work with Promoting Safe and Stable have to want to do the services provided. And so what we gear this program for is to maintain the family, to teach, to educate, to provide the corrective measures so that a family can successfully navigate through the program, make some positive changes, and maintain the family structures. We also have a Title IV program. Currently, Muskogee Nation Children and Family Services is working to develop our Title IV preprint plan, meaning that this program has been working for the last year and a half to get our preprint completed and then submit to our regional office. I am pleased to announce that we have completed all 7 sections of our preprint, and it has been turned in section by section. And so currently section 1 is with our regional officer being reviewed for approvals and or edits. Once we get through all 7 sections of our preprint, that would mean that we would be that much closer to have an implemented direct 4E program. I do have some statistics as far as how our program has been going. As of this quarter, our intake staff has processed 974 intakes and referrals. They've also processed eligibility verifications for both state and any of our tribal requests. They have completed 700 of those in this past quarter. FPT, which is the team that consists of intake and FPT staff, they consist of 13 staff. They have a need of 1 position, and that's a caseworker, and we just interviewed for and selected an individual, so we're waiting for them to go through the processes, after which they will have a case aide, and then they will be fully staffed, that is. As far as within FPT, they've completed 13 investigations this past quarter. They have open investigations of 128, and currently FPT has 25 children that they are looking over. Our TRP staff is consistent of 5 staff members, a program manager, 3 workers. They have a program manager, a supervisor, 3 caseworkers, and they need 2 caseworkers. They just interviewed last week and made a selection of those 2. So the only remaining is 1 case aide. This unit has a total of this last quarter of open cases of 44. Children in custody, 128 that they oversee. And then they have reunified 3 in this past quarter. So 3 children have returned home. Our SRP consists of 5 total staff members, a manager, 4 caseworkers, and this program is full. This program has completed, has an open case of 92 open cases with the state, and they are working with 149 children. Our OOJ program consists of 3 staff, 1 manager, and 2 caseworkers, and they have the ability to hire 2 more. Our OOJ manager works diligently in preparing our caseworkers for state court systems. And so she gets 2 really well-trained, and then we bring her in her remaining 2. So we will try to get those filled by the end of this year so that she'll have a full staff. Currently, OOJ has 35 open cases with the state, and they are working with 56 children. Our AGPC consists of 2 workers, a manager, and 1 caseworker. They have 1 position that is open, and we will have it filled by the end of this year. Currently, they have worked with 46 families in this past quarter, and they have currently 45 children in custody that they work with. And again, AGPC, that's working with adoptions, guardianships, and permanent custodies. CPRT consists of 7 staff members, a manager, 5 caseworkers, and 1 outreach specialist, and that program is fully staffed. In this last quarter, they had 50 resource homes open. They had 24 placement requests, and of the 24, they were able to fill 15. As far as our PSSF program, there are 9 staff. They consist of a manager, a supervisor, 6 caseworkers, and 1 case aide, and that program is fully staffed as well. PSSF has worked 24 new cases this past quarter, and they currently have 41 active cases. The services that they have provided has been outstanding. They have serviced and provided services of 270 different courses that they have taught to their families that they work with. And that's a lot of hours. Our Title IV-E consists of 3 staff, a manager, a Title IV-E specialist, and a case management. This program is fully staffed as well. As I said previously, to date, CFSA currently has 52 staff. We have 3 that are waiting for the processes to be complete with HR, and our organizational chart is reflective of 63, so we are almost there. During the past 3 years, CFSA has been able to complete their policy and procedure review. We have now taken it out of a draft form, and it's now sitting on the Secretary of Community and Human Services desk waiting for review and approval. It is a living body of processes and procedures. So from time to time, it will be updated and changed, but currently we are waiting to get final approval on it. We've completed our business process mapping of our program. Our Title IV-E preprint is near completion and approval. So I would say that CFSA has been very busy this last 3 years. I thank you for your time.
Thank you very much. Next, we have Developmental Disability Advocacy, Cynthia Smith.
I did want to clarify one thing, and Michelle, they have definitely been hard at work on our 4E. And what that 4E means is that we will deal government to government. We will no longer have to utilize the state as a pass-through when it comes to funding our foster care payments. Anything that we have to do with foster care, once we complete that, we will deal directly with the federal government. So we will. That's the exciting news about it with 4E, is that we will be a government to government opportunity, as well as being able to receive some of those reimbursements and activities that we do. So some of that, so the monies that is offered through 4E, we will definitely be able to bring some of that money home, making sure we earmark it for CFSA. And as we do that, then we grow and able to grow that program in order to provide more services to our family and our children. So I just wanted to kind of share that quick note with you.
Thank you.
To add, we are super excited. We now have 2 satellite offices. We have a space to house us out of Holdenville and then out of Oklahoma City. So we're super excited about being able to branch out some more to provide services. We're also looking at finding some resources for us to be able to bring services out to our communities, especially down in the South and then over towards Oklahoma City, so that, we don't have to have any families travel in to do any of their education and or drug screening. We would have that ability to have it out in the community. That's still in development. And so hopefully, by this time next year, we can provide a report that we have implemented that as well. Thank you.
Thank you.
Hello, my name is Cynthia Smith. I'm the director of the Developmental Disabilities Advocacy Program. It's a brand new program. I started this in 22. And so what we've developed is we are one of the first tribes to actually have a program like this in the whole United States. There is a tribe after us that started one, a consortium up in Michigan, the Michigan area, and then also the Navajo Nation, but they are not joined with the tribe. They are their own entity. So we are one of the first to kind of spearhead this. Excuse me, I've been sick as well. I'm sure everybody else has. But this was a new thing for us to start, especially this is one of the areas that I have not been, I was not well versed in. And so it was a learning process. So what we do is we provide resources, information, referrals to those parents that have kids that have developmental disabilities. So whatever the need is, we look for that need in their area because there's a lot of people that don't know where to start. The health network is very complex for them. They don't know where to go, where to start. Is it a behavioral health thing? Is it a sickness? Is it an illness? And so new parents, when they start and they find out that their child has something, they have no idea where to start. Okay, so we give them, we try to give them that information. We try to help them. We help the caregivers. We show them different resources such as Sooner Select or Sooner Start that offer different activities, different services for each person. Okay, some may offer transportation. Some may offer respite care. Some may offer, just a different service for that person. We have different people that have come in. We have taken over, and I have added my PowerPoint in that notebook. We also have a grant that we give for $1,000 if they can justify their or give us documentation that they have a developmental disability. That helps. We ask that they, if they have an autistic child, to buy something sensory mode, make a sensory area, anything like that to help their child, a reading issue, speech issue, anything like that. We also go to the schools. We go to community meetings. We have a person, I have two staff, an office coordinator and a caseworker. The caseworker goes out once a month to HRO and the following week to SRO. And so we make ourselves available to those who maybe can't come to Okmulgee to see us and go to the schools. We go to health fairs. We are going to also have in March is Developmental Disabilities Awareness Month. We're going to have a proclamation for that month. We are also going to be a virtual site for what we call Joining Forces virtual conference, and it's the Power of We is what it's called. We have secured a venue. We are securing other things and having an agenda for that. There is a registration online that is also in your packet. And then we also have our informational card in there as well. We service 0 to 17. And we help anybody that comes in to help, that needs the help. We've received calls from out-of-state people, citizens, that just need to know where to go. We try to give them at least one phone number to where they can call, and it's usually Family Voices organization that I have gotten my grant from, and they have an office in every state. And so I give them that information if they are in a different state. Really try to help, at least give them one phone call, one phone number to give to. We've also added our cards in here. So if you ever have any questions or want to send somebody our way, don't hesitate to give them our numbers. We're glad to help in any way possible. Do you have any questions or?
Questions, audience online? Mado, Mrs. Smith. Appreciate it.
Thank you.
Well done. Next, we have Elder Service, Rena Tiger, please.
Good morning. Hi, my name is Rena Tiger, and I am the director of the Elder Services Program. Under the Elder Services Program, we have the Elder Advocates Program, the Adult Protective Services Program, and our Ombudsman Program. Also, the CHR Program. The three programs that I mentioned at the very beginning, the Advocates, the APS, and the Ombudsman, we are tribal funded only. The CHR program is federally through IHS. I'll begin with the Elder Advocate Program. With our Elder Advocate Program, we assist our elders that are 55 and older, and that's on a needs basis. We have 3 elder advocates in the office, and all the programs, the 3 programs that I just mentioned, they're all based here in Okmulgee. The elder advocates, when a client calls, either sometimes when they're needing assistance, we can help out with referrals to other programs, help out with applications to any of the other Muskogee Creek services. We also have the Direct Assistance Program. And with that, that's on a needs basis, emergency basis. When they come in, we try to, inform them to use the other main services first, social services, TANF, all the other programs within social services. And then if they are actually being assisted through them and they have exhausted their services through them, then they can come over to our department and then we can see what we can do to assist. And some of the things that we do assist are with rental, down payment for an apartment or rental housing, groceries. Sometimes it might be appliances. And when it's something like that, we have to have the worker to go out and verify to see what the appliances needed. But again, everything that we do is up to 500. And we do that every 2 years. Because what we try to do is, again, we try to make them go and use the main services first. Right now, oh, I'm sorry. Do you have any questions in regards to the Elder Advocate Program? I'll go into the Adult Protective Services. With the Adult Protective Services, that is going to be 18 and over. And with that, we look into our vulnerable and incapacitated individuals, so that's why it's 18 and over. And we help out a lot that's within the Muskogee Creek Nation jurisdiction only. When we do get a call, we'll receive a referral. And in regards to that referral, we look into abuse, neglect, and exploitation. And so when that referral is brought in, the manager will look at it, assess it, and will assign it to the caseworker. The caseworker would then have 3 days, 72 hours to initiate the call. They will go in, they will assess the situation to see what's going on. Sometimes it will be just, assisting that elder in some services. And sometimes we'll have to go in there if they are not having the decision-making skills for themselves to, care for themselves. Sometimes we have to go a little further and maybe even looking at involuntary services for them. And sometimes that's looking at maybe nursing home or other facilities. Right now, we do have 7 in protective custody. On a monthly, we are looking at 20 cases that come in. And out of that 20, we will screen some of those out. So it's between 15 to 20 cases. In our ombudsman program, that has been going on for a couple months now. That's a newly program. We have 2 workers. One worker will go onto the south side, one will go into the north side. We have about 80 patients or clients, residents that we see. They will go into these residents and visit with the client, sit down, and if the client has a complaint, or if it could be anything, just sitting down and talking with that resident. But if they do have a complaint, that worker will bring it to the facilities manager, talk about it, and try to see if they can resolve it within the facility. If it is something that is of a bigger issue, they will have to notify the state ombudsman. This year or last year, they had went in and with the 80 clients, they had taken them some gifts, blankets, necessities, daily necessities for them, and they really did appreciate that. But I will say, as them going in, sometimes the residents are not, seeing anybody else. This may be the only people that, they see, and they really appreciate that, just to even talk with them, sit down and talk with them. Anybody have any questions in regards to the ombudsman?
Questions for representatives online?
Our CHR program, they are housed at the Okemah Hospital. They are getting ready to make a move to the old dental facility building. Pretty soon, not sure when the exact time is going to be, the date. There are 30 full-time staff, 5 that are in the office, 25 that are out transporting. He also provided me a location to all the places that they are staffed at. Creek County, Hughes, Ofusky, Okmulgee County, McIntosh, and Coweta. With CHR, and again, that is a that is a IHS funded federal fund there. I am still learning a lot about CHR. I actually started in the APS department 4 years ago. I started out as an APS worker and then became the manager and then the director. And so I'm still finding out a lot about CHR and what they do. But all these programs are under the Elder Services Department. And being a director is a lot. This is going on I haven't even come to a year yet. So I'm still learning every day. It is a challenge at times, but I will do my very best. Anybody have any questions?
Questions? Thank you very much.
Thank you.
Appreciate it.
Hello.
Oh, next we have food distribution. Ms. Anna Sterner. Yes, ma'am. Yes.
Tammy's on her way down. I'm sorry, did I interrupt?
1 second, please. Yes, Representative Osborne.
I just wanted to let everybody know here in the room, I so appreciate the services that you provide to our citizens and what you're providing to us today as far as the documentation. I know is vital for me because when I'm out in the communities, if somebody asks me a question that I cannot answer, I have something that I can go back to. Certainly, I do not know your programs, but at least I'll have a guide and be able to navigate who they need to go to. So I just wanted to say that before any of your people might leave, I just wanted to make sure that everyone knew that. So thank you for that.
Thank you.
Thank
Thank
you
you.
very
I did want to point out too with the CHRs that I know we receive many calls saying somebody just called and they have an appointment tomorrow. Well, most of our CHRs are scheduled out at least 2 to 3 weeks in advance. So if it's an emergency, now if somebody cancels and they have the opportunity to actually be able to make that transport, they will. But most of the time, those transports are scheduled mainly about 3 weeks out. I would say at least 3 weeks out. So, and a lot of our CHRs, I believe, are doing what's it called? Dialysis. So we have a pretty good sized group that are transporting for dialysis patients. So just so those of that that are online here that are pretty new that don't understand why we can't just hop on and grab. We would love to. However, along with that, when we do have a situation and we are able to help do a transport, which is not a usual, but elder services will at times help to transport, especially if they already have an open case on an elder or someone that's in need. If they have an open case, they will try to make arrangements to help them out with transportation as well.
Chairman, if I may, I did want to just throw this out there on the summary. It does say that a typical time slot dedicated to a dialysis patient is equal to an 8-hour day. So, I mean, I can certainly see why we can't just jump on things like that when we've got dialysis patients. So again, I appreciate you all. Thank you.
Thank
you very much. Speaker.
Thank you, Chairman. Ms. Tiger, a couple of things. One, I get a lot of phone calls like when the tribe shuts down, inclement weather or things like that. Even though the tribe shut down, we still get calls from patients I still need a ride to my dialysis. So I don't know how the tribe can fix that or if there's a plan for that, but just some FYI. And then another issue, I don't know if you've heard, there's rumor about the dialysis in Bristol and maybe shutting down. So just some FYI. So if that closes, then there's going to be another issue that's going to be on your hands. So, but anyway, I just wanted to bring those two topics your attention because I know I get several phone calls when the tribe shuts down. I mean, I get chewed out basically.
We get those too. And in regards to the transportation, I mean, we try to accommodate as much as we can. Sometimes, it just depends on what our schedule is too, because we have people that come in for the direct assistance and we only have 3 workers at this time. But we do try to accommodate, and we look at the need at that time. Sometimes, and then we ask too, 2 weeks in advance. Or
It's one of those hard things. It's safety.
Right.
You want safety first, but then you're looking at the patients. Well, I need my dialysis.
Right.
So, and I totally understand. Anyway, and I don't know how much longer I will be in here, but I do want to say to everybody here, I do appreciate what you do. You guys are the frontline workers, really, and I know we get a lot of phone calls, and I know it's not as much as you get, and I know the phone calls that you receive aren't always pleasant, but it comes with it, and I just want to say thank you all for what you do. So, Chairman.
Oh, thank you, Speaker.
And comment on the CHR also in regards to inclement weather. When we do know that there is inclement weather coming or approaching, one, we've always made sure that there is a backup plan for our citizens, letting them know that, if this weather's coming in, do we need to make arrangements to do an extra dialysis on a different day prior to that? Have you gone to your backup plan, what your doctor had? So we do check in. We don't just like pick them up. We're not just an Uber. We do try to make sure that that there are plans in place. We do have drivers that, although there is going to be inclement weather, they will go ahead and schedule and they will transport to those dialysis. Now, it just depends on what it looks like. If they get to a certain point and they aren't going to make it, they unfortunately would have to turn around because it is about the safety of the citizen and for themselves. But they do make sure that they have backup plans, contingency plans for those inclement weather days, as well as there may be times if something happens. Let's say our CHR has a flat or there's an issue with their car. What happens is there's always somebody on their list. They have to have somebody on their list that's their backup driver. It may be a neighbor, it could be a relative, but they also have someone that is on as a backup driver for them in case any of that happens. So there are some contingency plans in place, and when we know we're going to have a holiday, we inform our citizens like a month in advance. This is going to be a holiday. And they will have to. They signed the paper saying that they've been notified that we are going to be closed on a certain holiday, so that they are aware that they have to have an alternate driver or transportation to their appointment. So that is a little bit of maybe what you were asking about.
And thank you for that information because I didn't know that.
Mm-hmm.
And that's the whole purpose of this little meeting today is I know there's always 2 sides to a story. We don't always get the other story. We only get one. I called them. They're not going to take me, blah, blah, blah. So, but that's good information. So thank you. Thank you, Chair.
Thank you. Thank you, Speaker.
I just wanted to mention one more thing.
Absolutely.
We're known for our activities we do with elders also. And next week we're having our Sweetheart Dance, and it's on the 19th. And we have filled up I think we filled up the third week we started registrations, and we are up to 650. And I think we're going to have to look at maybe next year, maybe doing it two, because right now we still have people on the waiting list. And, we're trying to get to them, but we still have people calling in, put me on that list. But we will be out there next week on the 19th, and come out and join us. The dancer right there. Thank you.
Certainly. Thank you very much, and always looking forward to that. Next, we have the food distribution. Miss Anna Sterner, please. Thank you.
Hello, my name is Tammy Ringgold. I'm the Assistant Director for the Food Services Programs. Just a quick history. Anna and I both started together in 2009 with just food distribution. Back in 2016, she took elderly nutrition under her wing, which is why it became the food service programs. In about 2017 or 2018, with the elderly nutrition being a federal program at that time, the caregiver program could not exist without the elderly nutrition program. So we felt it was best that we took the caregiver program as well, to make it easier for the grant process. The tiny homes came along when one of our caregiver advocates had this great idea to build the tiny homes for homeless elders. It was elders at that time. And so that's where the tiny homes came from. But I'm just going to go one at a time quickly. I'm not much of a talker, so bear with me. I'm going to start with the food distribution program. The food distribution program is a USDA program. It is a federal program that is for low-income Native American families that live within the Muskogee Nation jurisdiction. We currently do not service inside the city limits of Tulsa, but we do service everywhere else. We have 3 sites, one in Okmulgee, which is our main site. We have a site in Wetumpka and one in Coweta. We do offer home deliveries for elder and disabled participants who are not able to make it into the centers. And I did give you guys a calendar for each site that tells you when we do the deliveries in those areas. And now the food distribution program is an alternative to SNAP. So you cannot receive SNAP and food distribution at the same time, because with USDA, it is the same pot of money, so you can't get both. So that is something to keep in mind if somebody asks you about food distribution. They can't receive SNAP. That is a big, we just can't do it. Moving on to elderly nutrition. Does anybody have questions about food distribution? I know I'm going quick, so.
Representative Osborne.
Thank you, Chairman. Why is it that you cannot provide services to the city of Tulsa?
Because USDA originally built the food distribution program to assist tribal citizens that were in rural areas. So it has taken us a long time. We just recently opened up Muskogee and Broken Arrow. We were not able to service inside the city limits of there either. So currently Tulsa is still closed to us, but we're working on that. So, any other questions about food?
Christian, Representative Crawford.
Do you all have any plans to open up another center in the Muskogee district?
That hasn't been discussed. I do know that if we open up Tulsa, when we open up Tulsa, not if, but when we open up Tulsa, we will probably, depending on how many we get in, might have to consider opening another site somewhere, but that we don't know where yet. So, thank you.
Thank you, Representative Crawford.
Any other questions?
Questions?
Okay. All right, so we'll move on to elderly nutrition. The elderly nutrition program is for Creek citizens. It was a federal program, but just recently in April, we became 100% tribal. And so now we just service Creek citizens that are 55 years or older. We do have 9 centers. We also provide mobile food deliveries to Twin Hills, Dustin. We was delivering to Walika, but we actually deliver out of Wetumpka every day from there now, instead of just doing the deliveries every once in a while. I know a lot of you are pretty familiar with elderly nutrition. Does anybody have any questions about elderly nutrition?
Questions, Representative online?
Okay. All right. I told you I'm going to make this quick. Okay, the Caregiver Support Program. This program is specifically to support the caregiver of the home. A caregiver could be anybody that takes care of an elder, a disabled child or adult. We do provide services to help with respite care, which will pay for somebody to come in and help you take care of that elder or disabled person while you go shopping, while you work, just something to give you a break. Everybody needs a break once in a while because it's a lot of work taking care of a disabled person or an elder full time. We do have support programs within the caregiver program. Our advocates go out and they do rock painting, and we just recently started Tai Chi and just things to relieve them and to get their stress level down. So there are eligibility requirements that is on the RAC card. But if you do have any questions about that, I'll be happy to answer.
Yes, Representative Osborne.
Yes, so 30 hours a quarter is all they can get because it's $10 an hour and 30 hours a quarter.
And who is that you're talking about?
The respite care.
Respite
Yes.
care. $10 an hour. Okay. Because I've been questioned about the hourly rate by one lady every time I go to the community meeting. Doesn't feel it's enough per hour, I guess, $10 an hour. So she's asked me if we've ever considered increasing that amount. Well, I'm just going to put that out there.
Yeah.
All I can do.
Yeah, if we do increase it with it being a tribal program now, we would definitely have to ask for more money. So we do also have a lending closet that helps our caregivers. They have like walkers, wheelchairs. We just recently purchased a couple of ramps that are lenders. They're just loaners, so we can take them and things like that. So we do provide like pull-ups, wipes, bed pads, things like that to help with the cost, all that. Any other questions?
Any other questions? Questions online? Questions, representatives in the audience?
Chairman,
Yes, ma'am.
good question.
Representative Osborne.
I saw in this brochure, grandparents raising grandchildren. Is there a subsidy or anything that's offered to grandparents?
They do allow, again, respite care. If the grandparent needs to go do something, then now we don't get very many of them, but again, it's the $10 an hour, 30 hours max. We do offer to pay for like camps. Again, it's $300 per quarter. So if they want to send their child to a summer camp or anything like that, then we will pay for that up to $300.
But no subsidy for the grandparent or grandparents that are raising their grandchildren.
Just the respite care, like we don't, yeah, that's it really. And then we pay for the other things if they need it. We have paid for like pull-ups and things like that if they need it.
I thank you, Representative. Any other questions? Thank you very much.
Okay, and then final one are tiny homes. The tiny homes program, we currently have 4 tiny homes over there by the elderly nutrition or elderly housing, sorry. I don't know if you guys have seen it right there off of Gun Club. Our program manager does a case-by-case basis with them, so I don't have a RAC card for them because everybody's different. So we do have a committee that determines whether the person is eligible to be in the tiny homes. It is a temporary housing, 60 days. Our program manager does advocate a lot for each participant. She will find all kinds of resources for them. She does work with them more than a weekly basis, but usually a weekly basis. She does help them find jobs. She helps them find some sort of income, housing, different things like that, and all within that 60 days. It goes very quickly. So she works very hard trying to get them in alternative housing. And it is just for Creek citizens only.
Any questions? All right, thank you very much.
Thank you.
All right, have a good afternoon. Next, we have Social Services, Iris G, please. Oh.
Hello, my name is Iris G. I'm the Director of Social Services. One of the best things about working for social services is we get to impact people from when they're very young, and we process their first Head Start payment for school clothing. And then we get to work with families, sort of that end of life care, helping families work through getting some funeral and burial costs. And it's very humbling to see people and interact with them throughout their entire lives. And we work with such a large range of the population. And because of that, social services has a lot of programs. So social services is in 4 offices. We're in Okmulgee, we're in Jinx, Holdenville, and SRO in Wetumpka. We have 36 employees, and we have 16 programs. So I prepared some slides. I'm going to go over sort of like the broad departments and a little bit about what they do. But I think what would be really helpful for you is the last 2 slides, where I list all the programs, what they help with, what tribe you have to be, an income guideline, and how much we can help with. So, Social Security Assistance Program. This program helps Muskogee Creek citizens, their spouses and children apply for Social Security benefits. That's SSDI, SSI, Medicare, and retirement. What the SSAP workers would want me to tell you is that we're not Social Security. So if they get denied through Social Security, that's the decision. We can help appeal. We can help walk them through the process. What our case managers do is to help people navigate a really laborious and hard process to navigate. We stay on top of their mail. We're making sure that they send back forms that they need to send back. It's very hard to get Social Security for some people, so we're just trying to help give people a leg up so they have a little bit of help navigating the process. School clothing. This program helps our students, Muskogee Creeks, from Head Start to college. The amount will vary depending on what grade you're in. It is our biggest program. Last year, we helped 14,052 kids in 2025. So that's about maybe 15% of our total population that will receive help through this program. Energy assistance. The big one for this one is our Elder Tribal Energy Program that helps Creek elders 55 and older and disabled Creek citizens with energy payments twice a year for $600. We got a lot of feedback on this program, and I do want to talk a little bit about how we made it so much better this year for this season. I think before in the past, it was seen as very rigid on what we could help with. Why do I have to have this bill this season and another bill next season? So we went back and with the support of leadership, was able to change the policy. Now elders can pick whatever bill they want for whatever season they want. So if they find in winter that, hey, I'm not using that much propane, I'd rather do my electric, you can do your electric. The other part was how we process it. We worked a lot with IT and the Salesforce team to say, how can we make these go faster? And I'm really proud of the energy staff this year because we've had some complaints about timeliness, but they have been reduced significantly this year. And we've been getting that assistance out to elders so they don't have to worry about cutoffs or disconnects on their bill. Energy program will also include things like LIHEAP. It will also include things like our AC program. And it may not be so relevant this year because I guess winter is over, but we are looking at implementing a LIHEAP heater program because I know that is a need when it gets really cold, is no one really gives out any type of heating assistance, like a physical object. So that is something we're working on. Again, I don't know how relevant it will be, but definitely wanted to carry that on. So when you do have calls about, hey, it's just too cold in my home, maybe we could look at doing something under LIHEAP heater. The last one, social services programs. So this mainly helps with rent and utilities. We do a lot of like helping people move into their first apartment or unhoused individuals maybe moving in somewhere. The other programs are medical travel, which helps people with gas money if they have to travel over 25 miles. This is big, especially for our rural citizens who maybe live in Wetumpka and have to travel to Oklahoma City for cancer treatments. So when you have individuals like that, send them our way so we can look at doing some reimbursement for those fuel costs. The disaster program, a lot of fires have been happening. Tornado season, this is when you lose some of the contents in your home. So like your roof crushes in due to a storm and like it floods all of your bedroom set. Well, now you need a new bed, things like that. And that's what the disaster program is designed to do. Also included in that is our burial programs. So things like tribal burial, which helps up to $7,000 in funeral expenses. It's the grave house program that helps citizens get a grave house, and then food for funeral for help for food costs. That's just a little bit of the things we do. And I will go over how the last two slides are structured. So you'll see I'll have the program on the left, and there's all 16 of them there. And those are the names you can reference if you have citizens that need to call in and they can specifically say, I'm interested in LIHEAP crisis. You have the type of assistance, so what we help with, and those are pretty much it. So that's like 99.9% of the specific things we do help with. You have the tribal requirements, so some are open to members of interly federated and recognized tribe. Some are just Muskogee Creek. You have the location requirement, so some are just people on the reservation. Some you can live anywhere. And then the income requirements of that program and the assistance amounts. And then that will vary. So some of them are, you can only apply once a year. Some of them you can apply 2 times a year. Some of those are the lifetime amounts. But we can always get into the specifics if you do have those questions. But any questions at all?
Any questions?
Ms. G, are these programs on the Camp House portal?
No, we have school clothing, tribal energy, LIHEAP, and we're about to do LIHEAP crisis and LIHEAP heater on the Camp House portal, but the other ones are not.
So with the programs that are on the Camp House portal, does that expedite
Yes,
the
it
process?
extremely expedites the process. We're trying to get the priority for us, and I know we have to wait in line and behind other programs, is to get the burial programs on there. I think that would be our first priority, and then slowly get the other ones on there. But we have been in talks about burial so far.
Okay, thank you. Thank you, Chair.
Representative Crawford.
Has there been any planning? I've had some citizens call and ask about, since the utility rates have increased, about increasing the LIHEAP amount.
That's a great question, because the LIHEAP amount we reduced this year, and we had a reason for this. Our LIHEAP amount has stayed consistent that we get from the federal government for years now. It's about 300,000. We were turning away maybe 200 applicants every season. So we would get, 400 people applying, and we had to deny about half of them. So we lowered the rate a little bit, so maybe we could fit a little bit more people in. One of the things on our plan too, I don't know when it will come about, is to get with the state and see if we can do a state tribal agreement where the state will allow us to have some of their money essentially, so we can open up and make those payments bigger, because we do cover Tulsa, which that would make a bunch of people eligible if it's in a federally recognized tribe.
Thank you.
Representative King.
On this NAHASDA, mortgage utility property tax, is that available to our own NAHASDA homes, or who are in our program?
No, so that would be sort of like double dipping. So we couldn't,
Gotcha.
yeah, if you're in NAHASDA, we couldn't help you pay with NAHASDA. Yeah, but if those people do run into help or need assistance, there is the hardship program, which also helps run with the utilities. It is less though.
Any questions from representatives online or in the audience? Not, thank you very much.
Thank you.
I would just at this time, I was notified that Dr. Harjo, she has a meeting here shortly, so we're going to go ahead and ask if she could come forward and give her report quickly also. So I appreciate your patience and time that she's allowed here.
All right. Meadow, for allowing us to jump up in the line. We have a call with the United States Department of Ed that starts at 12:30 to review the tribal consultation for interagencies, the conversation to where they want to move the Department of Education programs over into the Department of the Labor or to Department of the Interior. So it's a pretty large call. They requested us to be in person. However, virtual was an option for now. So good afternoon. I'm Kaila Harjo. I'm the Secretary of Education here for the Muskogee Creek Nation. I've been with you all since June of 2021. So under the Department of Education, we have roughly 12 different programs that provides assistance to our scholars throughout our reservation, but of course also beyond the reservation, depending on that service. Under the Department of Ed, we have roughly 150 staff. Of that, we have those 12 different program managers. One of the things that we looked at when we did our strategic plan was looking at the education level and the level of qualification for our program managers to oversee our Department of Ed programs. To date, roughly About 50% of our program managers have master's degrees. Some of them are currently in the process of completion, and so the other 50% of our staff either have a bachelor's or are fixing to be completing their master's degrees. So all of our program managers are highly qualified to be over the programs that they provide oversight for. So in the little booklet that you received, and I'm just going to give you a quick overview of these programs because you're going to get the full detail of our programs next week when we meet with you at River Spirit. So we have a couple of different programs that we have that oversee our grant projects. So our Muskogee Education Services is a program that was formerly ACE that you're probably familiar with. So we've taken that grant and we've looked at different opportunities as to what our students need throughout the reservation. And so that program is also now the oversight of our new NYCP 25 grant. That's the new $3 million that we've received for college and career readiness. But then also it focuses on STEM and also focuses on business entrepreneurship for our Muskogee youth. Next week, Adrian's going to go into more detail about those entrepreneurship opportunities. It's amazing opportunities for our youth to learn how to establish business. What does it look like for LLCs? What does it look like to create fiscal budgets and that type of thing for financial oversight? So really excited about that. A program you're probably familiar with is employment and training. So under that program is where we have our adult work program, our summer youth program, our Youth Works program, which is part of our driver's ed program, college and career readiness for our at-risk youth. And then, of course, just really looking at providing a tribal grant and tribal incentive for our technical and vocational students. So when you get calls from students, if they're going to Green Country Technology Center, Indian Capital, West Watkins, OSUIT, those students are served under employment and training since they are vocational. Our other higher ed students, for our post-secondary, bachelor's level, master's, doctoral, they are all funded through our higher education department under Marcia Taylor. Roughly, we have close to about 2,000 scholars under our higher ed program. And so with that transition to the Camp House portal and that application process, we've streamlined how fast we can get out those payments to our higher ed students. When I first came on board, I think you all had thousands of questions of how can we get our students paid faster? And it became an issue to where we looked internally and said, okay, the process we are doing is antiquated. We need to reevaluate how we're going to approve and process applications. And so the Camp House portal with Salesforce, that was obviously the next best thing when it came to client verification for citizenship. And so that has really helped us expedite those payments tremendously. We don't get a lot of calls saying, how come I'm not being funded yet? But the calls we do get funded on is one of the things I wanted to focus on. Why am I not getting my payments until around March? Well, we do that because we stagger our payment system on how the United States Department of Ed staggers theirs with federal student aid. We are not going to give thousands of dollars to a freshman level student 2 weeks into class when they can withdraw and then we lose our money because 9 times out of 10, they don't know that they're supposed to return those funds and pay us back. So we do give that 30 to 60 day window to make sure that we can still verify full-time enrollment status before we make that final payment towards their student account. One of the things that we are going to look to doing is implementing a financial need analysis form. And what that does is it gives us an idea of what that student truly needs to be and meet their unmet need to attend a college. For example, we have a student who goes to Haskell. Haskell costs roughly $800 a semester, and that is room and board, tuition, all of those things. Well, if they get a full Pell, which is about $37.60 every semester, they get the difference of that in their pocket. Then they turn around and they request $125 per credit hour from us. That money goes directly back to that student. So the way we can increase what we award per student per credit hour is to really make sure we limit the money that we're sending out to students who aren't in dire need of those higher education funds and reroute those to our students who don't qualify for federal aid. And then we can then increase how much we pay per student hour up to almost $350 per credit hour. And so you'll see that legislation over the next 6 to 7 months and us proposing that to the full council. Also under my office, we have the Eufaula Dormitory. We are a tribally controlled residential school, which means we are a peripheral dorm, which means we only house them and then we transport them to the Eufaula public school system. We have roughly 50 students on campus, anywhere from an average of 43 to 50 per semester. we like to keep it at 60 as our max. And I say that because we like to only house 2 students per room. Back in the day, there used to be 4 per room. And when you get 4 kids in a room, not very big, it creates a lot of chaos. And one of the things that we've learned in order to promote healing for our students is that they need their own space. About 40% of our students, this is the first time they've ever had their own bed, an actual bed to sleep in. And so for us to promote a space of healing and a safe space for them to come home to from school, it's very important that we maintain that less than 60 full-time enrollment in students. We provide everything for every student that comes to our dorm. We provide the bedding, we provide body wash, shampoo, all of those things, but we do take donations throughout the year. However, we do ask that when donations are made, they communicate with Melanie Taylor, our dorm administrator, to ensure that they don't violate BIE regulations. For example, we're not allowed to have toothpicks, dental strips, mouthwash, that type of thing, because it's what they call, quote, contraband, because it does contain alcohol. The toothpicks could be considered as a weapon. And so really trying to stray away from that old institutionalized approach to how we take care of our students. But until we are 100% tribally funded, we still have to follow those federal regulations in terms of what we allow inside the dormitories. We are currently working with Bobby Howard and Lighthorse to hire a school resource officer. That's going to allow for us to do more student searches. Over the last 3 years, THC and vape pens have been a common problem throughout all of our reservation schools. But one of the things that if we can control the entrance of those in our dormitory while we've got students of the ages of 1st grade through 12th grade, the less we can limit the exposure, the better. And so for us to be able to have that type of outsource and outreach on campus is going to be tremendous for the growth of our students, but for the safety of our students as well. And so we're looking forward to that. Under my office, we also have the Head Start program. Head Start is a controversial program, and it's going to be a program that is being discussed this afternoon. The Department of Education, when they become dismantled, if you will, they want to do away with Head Start programs. And so what that means for us is that we have to find a way to continue to supplement our younger students with educational opportunities in the Head Start program. And so for us, we are partnering with schools to create collaboration schools. And so we've started that this fiscal year. We have closed our Eufaula Head Start, and we have created a collaboration with Eufaula Public Schools to see what that is going to look like in today's time. We do have other collaboration sites with Doer, and so those have always worked well for us because that means 50% of our federal money helps us offset that instead of 100% for the operation. Full enrollment for Head Start is 289. We currently have 289, and we roughly have 40 to 45 students on the waiting list at any given time. So the need for Head Start is there. It's just convincing the Department of Education in the United States and Children and Family Administration that this is a vital program to the needs and for the growth of our future scholars and our future leaders for us to maintain. And so looking to continue to advocate for that. Another program that we have is our Scholarship Foundation that is operated and directed by P.D. Kozier Jr. P.D. has been with us roughly 10 years, if not more. He has overseen higher education as well as the foundation, and his dad, Dr. Kozier, is actually the one who initiated the foundation. And so for him to come in and take over this program has been something that he has taken priority in. Over the last 2 years, PD and his team have created a scholarship foundation tag where all of those proceeds come back to benefit the scholarship foundation, but also worked with the gaming enterprises to have the change donated back to the programs. They average about $36,000 around per quarter is my guess, if not per fiscal year. It really just varies because there's so many different options available for everyone to donate their change. But for us to say that 100% of the money that is given to this foundation goes back to scholarships is very important for our students to understand. This is free money sitting on the table for them to apply to. It is very competitive. One of the most competitive ones is the Aristocrat Scholarship. That's a $5,000 award, and that is paid to the student, and that helps them offset any cost of attendance that they have, whether that's personal related cost or academic related. They can use those funds to help make sure that their unmet need is always met. Let's see. We'll do Johnson O'Malley last because we have that one Johnson O'Malley conversation we want to have. We also have another NYCP grant that is rolling into its 5th year, and it has been focused on a Native Arts curriculum. And so for those of you who know Cassandra Thompson, she has taken this Native Arts curriculum and just ran with it. We have looked, she's created a wild onion curriculum that is phenomenal. She's done a Creek Ham curriculum that's phenomenal. And once all of that is combined into a book together, that's going to be an available resource for our 67 reservation schools to have access to. November rolls around, everybody wants to know, what can we do for Native American Heritage Month? Well, now we have a book that is produced by a Muskogee citizen and our program to distribute out to our students to say, hey, these are some of the things that you take and learn how to do. But then, of course, you think about all of the things that go into who taught all of these individuals how to do it. She's documenting that through little short videos as well. And so to hear those elders talk about their grandmothers teaching them to sew or their grandmothers teaching them how to cook, it just shows you the years of generational learning that has taken place. And it's almost if you're there learning with their grandmothers as well. And so it's very much of a heart work as it is hard work that she's put in. And so we're very thankful for her work on that. But then also Shannon Barnett has taken over our college and career readiness. And so within this grant, we have 4 partnering schools, Graham Dustin, Eufaula Dorm, and Old Mulgee. We have funds available to assist any of those students at any given time. So if you have students that are in those areas, please reach out to us and let us know. We've helped restock the food banks at a couple of those schools. We've helped with college tours and that type of thing. So if there's something that you know of students in those areas, please get with us and let us know, and we'll do the best we can to support. But some of the things that I like that we do is we challenge them for our 9 weeks challenges, whether it's perfect attendance at 3.0. They recently went to the Tulsa Oilers game. The next thing up is an Oklahoma City Thunder game. Back in the fall, they did go to the OU football game. The point of this is to take them to have lived experiences they would possibly not get to experience if it wasn't for the Muskogee Creek Nation and our Department of Education. So we like to think that we're giving them a once-in-a-lifetime opportunity when it comes to these awards that they win through those challenges. Another program that we have located in Henrietta is our reintegration program. Our reintegration services our Muskogee citizens who are recently released or have been incarcerated within the last few months. And so they come into this program and they are subject to random screenings. But what we work on is we work on addressing the gaps and helping them acknowledge what got me to where I was in the first place. So we focus on that holistic healing instead of just the substance abuse and the alcohol abuse and those type of things. We look at that and say, if we can't help you identify what led you down this path, we're not doing you any justice. And so that's why I say we take that holistic approach. We use that white buffalo methodology within our meetings over at Reintegration. They recently celebrated 20 years of operations of being in service, serving our citizens. And so for them, they've been proven to help our citizens. And one of the things that I wanted to touch on and that Tony and Ryan will go into detail next week is that, you know, a lot of times, as much as we hate to say it's a one and done, we have to make sure, because our space is so limited in our housing down there, we have to set boundaries and we have to set rules and regulations, especially if we receive DOJ funding. One of the things we have to make sure is if they're violating any policies, any drug and alcohol screens that come back negative, that is terms for immediate release of that program. Unfortunately, we do have citizens that fall into that. However, please don't think that they just throw them out back into the streets. They do refer them over to either vocational rehab or over to employment and training to ensure that they're still getting the needs and the service that they need to kind of bridge that gap so that they can regain employment, get their driver's license back, and pay for those different assessments that they're needing for all of those different sanctions that they may have. Voc Rehab is located in Okemah. We service roughly anywhere from 60 to 80 clients at a time. And so this program assists anyone with physical or emotional or mental disorders or disabilities. And so that means they can come in. We help with workforce placement, workforce training, and even higher education tuition support through in that program. So very similar to how we do higher education, that funding is now reverted through voc rehab. And we use that money to make sure that they are fully employable once they meet the end of that IEP, which is their program, their individual plan that we place them on. At any given time, this program is, as long as the program hasn't started, they are eligible to get on the program. So we encourage them to just get the application submitted. And this is also one of those areas that we're looking to have an application updated as well. So that way we can expedite those services. Another area that I wanted to touch on real quick is our NCA one-time grant. It's the one-time $500 grant. So if you get someone that says, hey, I need help with my senior pictures, hey, I need help with just different senior expenses, this 500 one-time grant is available for them to use, just as long as it's payable to one vendor. We're working with our school districts to look at establishing students' accounts, so that way that they can order a class ring, their cap and gown, and all of those different things from various vendors. And we're only making one payment to the school. And the school is very good about sending back the remaining funds. However, if they request $250, that's all they're getting. They forfeit the remainder. So that's why I say we try to do it strategically and make sure that they can get the maximum amount of those funds when they're seeking those services. The last program we wanted to talk about is our Johnson O'Malley program, and I do have Brittany Lovett here with us today. So we currently service 54 of our 67 reservation schools are considered Johnson O'Malley. And so within that, the way we do our Johnson O'Malley is that we have our own Muskogee Creek Nation Johnson O'Malley handbook, and it outlines a list of all eligible items that are available to be paid for with our JOM monies. Last year, we did request a substantial amount of money to increase up to $75 per student. And with your grace and with your blessing, you did give us that money. However, when we came back in the fall, we were informed that because BIE only gave a set amount of money, we were not going to be able to give an increase. So the government reduced Johnson O'Malley monies. Well, I can't say they reduced it because they gave the same amount of money. However, when a student becomes JOM eligible, it reduces that pot of money for every other JOM student. And so for us, when we look at the 25,000 students we have here in our reservation and we want to pay them $50 out of the federal money and $25 out of the tribal money, and the $50 is reduced to $25, we're kind of right back to where we're started. And so we lost about 50% when it comes to the funding that we received for Johnson O'Malley. One of the areas that we've talked about is we were going to eliminate positions within our own department to help offset the loss that we had had. But fortunately, we were able to make sure we were able to roll over some funds. That's only a Band-Aid. And so for us, looking at how do we get people to advocate us at the national level to ensure that we are on the government's radar, that this money needs to be increased at an annual gift of increasing. The National Council provides the National JOM Association roughly $50,000 in donations every year. That $50,000 is awarded from the council, and it covers their conference. It goes towards their conference, the cost of their conference that they put on. This past year, they had a conference in Denver, Colorado. For one person to attend that event, it's $3,500. That's the $850 registration fee, and then the remainder is the per diem and the room, and then the travel. When you look at $3,500 and they had record numbers of 650, you're looking at $550,000 that they received just in registration alone. That doesn't include what it cost us as a nation to make that contribution. So one of the things we wanted to look at is seeing, could we propose you all to decrease that $50,000 donation to $10,000 and revert that 40 back to Brittany and her program so that we can increase that per student amount? Or would it be possible for us to come back later and look at an additional supplemental appropriation to help us offset that money that we're losing on the government side? I don't know the ins and outs of the donation that you all give. However, when we looked at the data and when we met with some former JOM individuals, there's not a lot of advocacy taking place at the national level for Johnson O'Malley. In the last 4 years, there have been 0 new JOM programs established from National Johnson O'Malley. Now, that's not to discredit the work that they do. However, it's more or less to bring light to the work that Brittany and her team of 4 can do within our reservation school. We can grow our JOM programs with additional funding. And so that's one of the things that we wanted to discuss, possibly maybe at a later date, just because we've got an agenda full of presentations today. But for the most part, all of our education programs that you have in this booklet are there. You've got contact numbers for every single one of them. I gave you each one of my business cards. I usually answer my phone throughout the evening. I've been good about putting it on Do Not Disturb at about 10. And so my phone number is also listed for all of our tribal citizens to have access to. So if they ever have any concerns about our programs or wanting to know where they're at in the funding process, they're able to contact me directly and I can reach out to my team. We are thankful for this time to just give you a little overview of what we have. Next week, you're going to hear a little more details and see the faces of those individual leaders who provide the direct supervision of those.
Are there any questions? Any? Questions from online or in person? If not, thank you, Dr. Harjo. Greatly appreciated. I know you're a busy person, so thank you for taking the time to do this. Very helpful.
Thank you. We appreciate it.
All right, we will continue with the Office of Child Care. We have Miss Yolanda Lewis, please.
All right, I'm with the Office of Child Care. We do have a few programs. I'll start with our subsidy program. So that is a 12-month eligibility program to help families with child care tuition. Part of the eligibility, the family must be working, going to school, training, or job search. So the families will put their provider on there, and so it could be a center, it could be a relative, it could be a grandparent. It just has to be, care has to be given outside of the home, not unless there's a medical, like something, medically wrong with the child, and then it's safer to have the child just stay in the home and the provider come into the house to provide care. So that is, let's see. So once they're approved, the family's approved, the inspection request is sent over to our licensing and monitoring program. So this program conducts 3 monthly visits a year. So it's based on health and safety. And right now, currently, we have 251 active providers on our program. On our subsidy program, we have 541 families, and we serve 862 children on that program. And on our licensing program, licensing and monitoring, we do help like fire extinguishers, carbon monoxide detectors, safety latches and plugs, emergency preparedness bags. We've also provide educational, so books to the families or providers. We also did grants to our providers. We've done 3 so far, like stabilization. So we've helped pay utilities and personnel incentives, STEM kits, which that's what we're currently working on right now. And minor renovation, we've helped with like playground costs. We've given them a grant. They've had to provide us with quotes on, improving their playground. And our subsidy program, so every year we also give out backpacks to all the children that are on our program. It is backpacks filled with school supplies. And we do that for all the children, school-age children, and the school-age children that's in our child development centers. So, and then we'll move on to, we have 7 child development centers. They're located in Okmulgee, Tulsa, Sapulpa, Holdenville, Wetumpka, and Okemah. I think I named them all. And right now we're looking, I would say within the next 2 months, to open those 3 child development centers that we're currently done with the construction. We're just now trying to fill them. We're trying to do all of our toys and supplies. We do have some teaching staff positions open, so that's one thing that we're working on is filling those positions. So I have about 6 at each location of those 3 new centers. So we want to get those staff on board, get them trained before we get them in the new center and start enrolling even more. Because right now those centers are licensed for like 35, but the new centers, they'll be licensed for 80 children. So we're more than double the amount of children that we can serve. We also have on our staff a Muskogee language instructor. So her name's Carol Fry. So she goes out 4 days a week. She goes out to all of our centers to spend time with each of the children, talking to them, just providing the language to them. Even the baby, just going into the infant room, holding them and just speaking the language and just really encouraging that. And then any activities she has, just learning educational activities for them. We do have a R&R program, so that's our resource and referral. And we have a training specialist, so she provides us with all of our trainings that, like our childcare providers have to have at least 20 hours of training. Our home providers and stuff have to have at least 12 hours. So that's her job to make sure that we're getting those trainings, as in like first aid, CPR, or safe sleep, just all the required DHS trainings that we may have. And then we have a resource and referral specialist. So she goes out every month to the centers. We have a van that she has. There's a curriculum. There's also like educational theme boxes that providers can check out. And we also have car seats, so that way if we have families on our program that are in need of car seats, we can also provide those as well. And currently we're going to partner with the Culturals and Humanity program for this immersion program. So we're going to start at our Okmulgee Center, and they're going to help us with more instructors to come into the center to sit with, the younger children to really encourage the language. And that would be what's pretty much spoken to our younger children. So we're starting at Okmulgee, and then we'll be branching out to all the centers. But Okmulgee is our biggest center, so and we're housed here, so we're just trying to start somewhere. But then we also help pay for like our background checks. Everyone has to have that. So that's one thing we wanted to do with this program is background checks, since they're going to be in the classrooms with our children all day long, making sure that they have proper training too as well, just like we have first aid and CPR, and then like a safe sleep. So you have to have certain training for infants. We wanted to make sure that they're all trained before they go into the classroom to help us. I think that pretty much. Do you have any questions?
Questions from the committee? Questions? Representative Harjo.
I don't have any questions. I just wanted to, this just thrills my heart because I remember way back in the day when half of about 4, and I worked with Wise, and see it come this far and what it's doing for our citizens.
Any other questions? Questions online? Very much.
Right, thank you.
Who? Next, we have the Southern Regional Office. At Nunley, please.
Hi, my name is Anjanette Taylor. I'm the site coordinator for the Southern Regional Office in Wetumpka and the Holdenville Regional Office. In your folders, you'll find the services that we provide to our citizens. I've been with the nation for 10 years since in September. Also, like in your folders, you'll find our business cards for the Southern Regional Office, which is for me and my assistant, Amy Spradlin. The Holdenville location, we have 2 navigators, which is Travis Yahola and Candace Buck. And we don't provide direct services to our citizens, but what we're here for is so that our citizens don't have to go to the Okmulgee location. And they are supposed to be here to work process through, assist with those, all the different programs the nation. Next 2 to 4 weeks, we will have a full-time staff that will be joining our Wetumpka location, be the citizenship office. And also at the Holdenville location, we will have 2 more language speakers that will be joining our staff at Holdenville. Do you have any questions?
Angie, housing. Housing is always a big thing. Have you talked to anyone about having housing in one of those offices?
One of the things is a lot of times there's a cleaning house in different departments. One of the things is that's been told to me is that they don't have enough staff to come down to these locations. But I am going to revisit that again because here within the last couple of months, my navigators have been doing a lot of housing applications. And although they don't take faxes or emails, we still go ahead and send that through to them and then see that paperwork process through and inter-office that. We do have that as a backup plan. But also, I let our citizens know that, hey, if you're unable to go to the Okmulgee, you can always ask them to come down to our location. Sometimes they'll even go to their house if needed. But that's one of the things, too. Like I am going to revisit that to see if we could get that started again. Because initially, when we first opened the Holdenville location, they were coming on a monthly basis, and then it got to where they wasn't coming. Staffing, though.
All right, next we have Miss Lauren Randall, Tribal Temporary Assistance.
Thomasine or W. Osborne. I did send in a note to Ronnie Rogers, who is acting right now, and asked that they would send someone from housing to at least be present a couple of times during the week, and we could set up a schedule.
I appreciate that. Thank you.
Good afternoon. I'm Lauren Randall, and I'm the director of the TANF program. So Muskogee Creek Nation, we were the first tribal TANF program in Oklahoma, and Cherokee Nation and Osage Nation are the other 2 TANF programs. So our program is for Native families, and so our mission is to help our families attain self-sufficiency through job coaching, helping them establish work experience through our volunteer sites or a site that they find. And so our monthly grant is based upon the household size. We offer two different types of cases. So we have family cases, which is the parents raising the children. We also have child-only cases, which for most of those are grandparents raising grandchildren or other caretaker relatives raising children. So for those cases, that caretaker relative does have to have guardianship of that child. I included our service area in the slides that I gave to you. So we service all 11 counties within the reservation area. We do overlap Cherokee Nation TANF in some counties, so we do coordinate with their office to determine who is going to take those citizens. For eligibility, we do we are a federally funded program, and so there are a lot of federal regulations that we have to follow. So there are a lot of eligibility requirements, and child support must be filed on all absent parents, whether it's a caretaker relative that has the child or if it's the parent, like a single parent raising the child. Child support does have to be filed on the absent parent. Any income that a family case receives is counted. So whether they receive child support, if they have income from a job or casino winnings, any income they receive is counted. So it does have an effect on the amount that they receive for their monthly grant. There is a 60-month time limit for TANF, and that spans whether they're on a tribal TANF program or a state program. So if they lived in California, we're going to count those California months total to determine how long they can be on our TANF program. And the caretaker relative cases, those, they do not have a time limit, and they're eligible to be on the program until the child turns 19 or they graduate from high school. Our needy family cases, the parents are required to do work participation hours. So they are either volunteering at one of our work sites, or they may have a job or go to school. And in return, if we're able to verify those hours each week, they are eligible to receive a $100 incentive for every week that they meet those hours. So that's in addition to the monthly cash assistance grant that they receive from our program. In our caretaker relative cases, they are not required to complete those work participation activities. We offer a lot of incentives for the adults that are in our program. We offer educational incentives. So if they achieve different levels of degrees within college or GED, we offer incentives for those. We also have 2 facilitators on staff that offer relationship sessions for 2 parent families. So they, upon completion of that program, they're eligible to receive an incentive for that. And when a participant comes on the TANF program, we complete a personal responsibility plan with them. So we set goals for them. If they don't have their GED, we help them set that goal. And our program is one of the few across the nation that partners with the Aztec software program. So with our program, our participants are able to take those GED lessons online, and then they're able to take that test. Whenever they meet those goals that they set for them, we also give them an incentive for meeting those goals. We offer various supportive services such as job skills training, helping them pay for professional licenses, if they need tools or equipment for their jobs or volunteering at a work site. We can help them with getting their driver's license. We can pay for car insurance, car repairs, professional clothing, help them pay for fines that are related to obtaining their driver's license. So all of these are only for TANF participants only. And with all of our services that we offer, if there are other tribal programs that offer that assistance, they do have to apply for those first. And then if they're denied, then they can apply for our services. We do also offer non-recurring short-term benefits where we can help pay for housing expenses such as rent, mortgage, if they need household appliances, emergency shelter. We can help pay for hotel stays up to 45 nights. We also do offer utility assistance, and if a family is experiencing a food crisis, we can help pay for food also. And for those participants, that's if they've depleted their commodities or their SNAP benefits, we can help pay for that assistance. And that, the non-recurring services, those are open to non-TANF and TANF participants, but they do have to meet TANF eligibility requirements to be eligible for those supportive services. We also have a diversion program. So those are people who have accepted full-time employment or are currently employed full-time, and they're experiencing a barrier to keeping that employment. So they maybe need car repairs or need a new set of tires, or maybe they're about to be evicted from their home. We can help pay up to $3,000 for different services for them to be able to maintain their employment. We also have a subsidized employment program, which is SEP for short. And those are, we try to work with different companies throughout the reservation area to place our TANF participants there. And they are employed full-time through those employers, and TANF pays, reimburses that company up to 100% of our participants' wages for 6 months. And our hope is after that 6 months, they retain them as a full-time employee. We also offer a lot of children and youth services. We offer different cultural activities with our youth portion of our program. We also do personal responsibility plans with our youth, and if they achieve goals, they can get incentives for achieving those. Whenever one of our children graduates, we give them high school completion incentives, and we offer, we do have to have their grades every 9 weeks. So at the end of each semester, if they have an A, B average, or they've made an improvement in a core subject, or they have perfect attendance, then our children receive incentives for those. We also have the suspension and transition part of our program. So a lot of people think that when they come on TANF and they get a job that they're not able to remain on TANF. They just move to a different portion of TANF where they are eligible to receive all the incentives and supportive services, but they don't receive the monthly cash assistance grant. So that period lasts for 6 months to a year. And if they complete that full year on TANF and they've met all the requirements, they're eligible for a $2,000 incentive at the end of that year period. The other services that we provide, we offer monthly workshops for the participants on our program. We do an orientation class whenever they first come on the program, so they are familiar with our forms and all of the services that we offer. We also have an in-house counselor that is for our TANF participants only. And when a participant goes off of our program, they are still able to utilize her services. And our contact information is on the back. And if you have any questions, I would be happy to answer those.
Any questions from the committee? Yes, Representative Osborne.
Thank you, Chair. Ms. Randall, how many participants do we have on our TANF program right now?
So right now we have 97 active cases with a total of 244 people on the program.
Thank you.
Thank you, Representative Osborne. Any other questions from the committee? Any other questions from representatives online or in the audience? If not, thank you very much, Ms. Lauren Randall. Appreciate your time. Thank you. Next, we have Tribal Juvenile Justice. Anna James, please. Thank you. Thank you. You have the floor. Thank you very much.
Hello, my name is Tecumseh James, and I am the Director for Tribal Juvenile Justice. I won't be before you long because I know everybody's hungry. We are the program under Community and Human Services for dealing with juveniles that commit crimes, that have behavior issues. On the last quarter, we had served 473 juveniles, 145 active court cases, 221 cases there was non-court involvement, and 107 new referrals. And what we are really went from, our program was started in July of 2020, right after McGirt. I was hired in November. We ran the department probably for 3 years with only 5 staff members. This last year, we have went from 5 to now 10 staff members. So we are growing. We are located in Omuggy. We also have an office now in Broken Arrow. And we also used intake rooms down in Holdenville whenever we have referrals from further south. Some of the programs that we are excited about are that we started over this I became the director in December of last year, and we started December of 2024, I'm sorry. We started a truancy program because we was getting a lot of complaints, and I know some of you guys was getting complaints because it came down from the National Council that we weren't doing anything with native truant kids. So we created a truancy program where we have MOUs with several schools where we go in and get referrals, and we put the kids on a 90-day program where they have to do life skill classes, and some of the schools are actually letting us come into the schools to do those life skill classes during school hours. So we are doing better with truancy. Not covered, like right now we're actually doing 8 schools as a pilot program, which we also will be including Tulsa County Public Schools as well in this next 30 days to start doing things in Tulsa County. We also started a program that we're excited about, and if I can say this word correctly, is the Fudgy Nini program. And of that 221 cases that I said that we screened out, and we also, they're screened out to state facilities, to youth services, but now we have a program where we're going to start our own, like a first offender program. It's the Right Path program for kids that are committing status offenses, that are first-time offenders. So we won't be referring them out to youth services anymore. We have our own program. I just hired a program coordinator, and she's with me. Y'all know her formerly as investigator Teresa Lee, who was with Lighthorse for 10 years. She has come over to our program, and she's going to be facilitating that program along with a program assistant. And another thing that we're excited about that we did, we just got an MOU signed with a transitional living program, and we're the first tribe to be doing this, for a 10-bed facility in Tulsa that was going to shut down. It was an adult mental health and substance abuse facility that was going to be shutting down in December this past year. And we was able to meet with Mental Health Association of Oklahoma, do an MOU with them, and we're going to have access to those beds only for our kids. They're only doing the contract with Muskogee Creek Nation. So we will have access to have something to do with our juveniles where they actually get treatment rather than just sending them to detention centers, which we have contracts with Creek County Detention and Sac and Fox Detention, and we also in communications with Tulsa County for a contract with them as well for detention, and also their crisis intervention center, which is a 24-hour holding center for kids that are having crisis. So we're moving forward. We're growing. We're offering programs. Our main thing that we want everyone to know is we're not just about locking up kids in our juvenile code. We are to use the least restrictive environment when it comes to dealing with juveniles that are committing crimes. Our 4 components of our program is restorative justice, prevention, intervention, and public safety. So that's what we focus on. And in our Fuchinini program, one thing that we are doing is we're not going to use any of the state curriculum that's out there. There's a lot that's we've been looking at. We actually have found a curriculum out of Arizona that it was written for Native American youth. And so I'm going to be sending our 2 staff that we just hired in March to go for a 4-day training to become certified facilitators of that curriculum. So we will be using that curriculum for our Native American children. And that's all I have to share. I think that's it. I think that's the most of it, but you can find it all in the little presentation. I didn't want to take up much of your time. Anybody have any questions?
Are there any questions from the committee? Questions from representative in the audience? Thank you, Ms. James.
Thank you.
Next, we have Women, Infants, and Children's. WIC, Kira Bunner, please. Oh.
Committee, my name is Katura Bunner. I'm the director for the child nutrition programs here at the Nation. I have given you a brochure or a rack card for our WIC breastfeeding and summer EBT program. And I will just, again, talk briefly through those, some of the services that we offer. I've seen you for the last couple of months on legislation for our grants, so I'm sure you're familiar with some of that already. Excuse me. So our WIC program is 100% federally funded. We provide a monthly food benefit based on risk criteria that is assessed when they come in for their appointments. Nutrition education, breastfeeding, shopping for our food program. Sorry, I feel nervous. I can hear my voice shaking. A lot of community support and referral services for our tribal programs and then some of our state programs that help support. And then we have a breastfeeding peer counselor program that's available 24/7 to provide breastfeeding support for our breastfeeding population through the whole journey, birth through when that ends for the parents. And then our summer EBT program is fairly new. We will be rolling into our second summer for that. It provides a $120 package benefit. That is a food package made up of WIC-approved foods. So it's not like a SNAP benefit where they can just roll out to the store and buy whatever they want. And it is set to roll out this summer in May. So we're already in our activity phase for that. That's all I have. If you have any questions.
All right.
Thanks
you,
for
Ms.
bearing with me.
Bunner. Are there any questions from the committee? Questions from representative in the audience? It looks like we have no questions, and I appreciate it.
Thank you.
Thank you very much. Next, finals. Come down to youth service. We have the one and only Mr. James Bender.
There we go. All right, so I gave you all a little PowerPoint to kind of look over some of the stuff that we've done. I'm going to kind of go over just the rack card that we have over some of the programs that we have with youth services. So we're going to start out with our mentorship program. That program is where we identify youth in the communities that may need some mentorship, some guidance, some support, whatever it may be. And we link them up with a responsible adult, citizen adult in our communities. What we're also doing with that is we're trying to change that up a little bit. So we have a youth council group we'll talk about here in a little bit, but as they age out at 24 and over, we're wanting to take these individuals and put them into our mentorship program so they already know the programs, have been in the communities, and also will give these individuals that are aging out, you know, what we hear them say is that they're aging out, that they have no place or purpose. So we're trying to help them find place and purpose with that mentorship program. So we work with the communities and the schools to identify these individuals and get them linked up. We have our Connect the Disconnect program, and that's where we take cultural activities to the communities, to our youth. So we'll go to the community centers, we'll go to schools. Here lately, we've been spending a lot of time in the school system. So we've been linking up with the JOM representatives within the school, and then going during school hours to do these cultural classes for our citizens. We've also been invited with our Connect, Disconnect, and our youth council to go to different areas to do our presentations and to talk about our culture. So one of the last ones we went on to was down to Dallas. And so we had a cultural day down in Dallas with our citizens down in that area. We go to Oklahoma City also. The other program, we're going to talk youth council. So this is all youth 12 to 24 can participate in this. So we kind of mimic what the National Council is doing. So all the issues that they see, the youth see in their communities that we bring up when we discuss, it's all 100% youth-led. We as staff are just there to support and guide, but all the activities that our youth decide to do and actions they do is all from them. Encourage you guys to come and sit and visit with us when we have our youth council meetings. We have it every second Saturday from 10 to noon over at the Youth Services building. We have the royalty program under Youth Services. So we have a pageant, we have a Miss and Junior Miss. The Miss is ages 14 through 18. The Junior Miss is 14 to 18, and the Miss is 18 to 24. With those, they run a year in ring, and as you guys know or see, they're everywhere doing everything all the time. So if you guys are needing them, please put in the request early so we can get them there for you guys. Lastly, we have the opportunity grant, and this is the chance for our youth to get monies that they may not have at home. So we want to do extracurricular activities, or, you know, we want to get basketball shoes, or we want just something that maybe mom and dad, they're having an issue with. They can apply for this and receive some grant funds. Within this, there's 3 different levels. So there's the most opportunity grant, which is the extracurricular activities, arts and clubs. They'll get $250. Then we have a driver's ed and tuition. They'll get a max of $500 for that. And then we have a leadership opportunity. So the leadership opportunity within state is $1,000. And if they travel outside of the state, they'll get up to $2,000 for those. But with everything that they receive, there are also some documents that's needed on the back end that shows that they did use the funds for what they said that they were going to use. Accountability on that end. Any questions?
Were there any questions from the committee? Representative Osborne?
Mr. Bender, has the scholarship prize, has it increased? I think it did recently, didn't it?
Yes, it increased it. So what we have is, this brochure is wrong. So what they're going to do for the Miss is going to be $7,000, and for the Junior Miss is going to be $4,500.
Okay, I thought it had increased.
Yeah.
Okay, thank you.
Thank you, Representative Osborne. Any questions from representatives of the audience? I have no questions. Appreciate it, Ms. Bender. Report. All right, Ms. Carmin.
Hey, we really appreciate the opportunity to come and present to you today. I know these were quick. It didn't seem like it was quick, but these are the programs, and I just want to say that the directors that have come up and presented today, we have the best of the best. We do. They work hard. This is a 24/7 job. It's not something that they work 8 to 5. It is a 24/7 hour, 357 days a year job. And I don't take credit for any of the accomplishments that they have made. They're true leaders in their field. They are the experts in their fields. And I just wanted to be able to say that they work as a team. There's not one program that doesn't feel like they could pick up the phone and call one another. We will continuously do that. That's what we do. But I just want to, kind of give that credit where credit is due. They're the best of the best. And so we appreciate the opportunity to come and present before you today.
Absolutely. Are there any comments from the committee? I would like to make a final comment. Once again, I would just like to reiterate that I appreciate your time. I appreciate you sticking it out with us. I know at times our meetings seem like they go by fast, but this information is very well needed for this committee, and I know for myself, and I look forward to being able to present this to my committee, or not to my committee, but to my community a little at a time. These are things that is very important for them to know. And like I said, I just appreciate your commitment. So, thank you very much. If that is all the other business, are there any announcements from the committee? Any announcements? If there are no announcements, I entertain a motion to adjourn. Representative Osborne made a motion to adjourn. May I have a second? Representative Harjo, second that motion. I'll call for a voice vote. All in favor? Aye, aye. Aye. All opposed, same sign. Motion carried. Benediction from Representative Osborne.
Father, I just thank you for this day and this opportunity to come and hear what our departments provide for our citizens, Father.
Yes.
I just ask for a special blessing for each and every program that we do have. And I just pray that we will offer compassion as we talk to our citizens. And a special prayer, Father, for Cassandra Thompson and her family today. I just pray that you'll give her what she needs during this difficult time, Father. And also lift her family up as well. And just pray, Father, for, again, the family and what Suda was able to do to all the things that she was able to do for her community, Father, and for the program that she was a part of, Father. I just pray travel blessings for those and just continue to bless our day, guide our actions and our thoughts and our words. I ask all these things in Jesus' name. Amen.
Amen. Meeting adjourned, 12:42. Yay.